All right, we are going to be talking about vaginal discharge today. Yes, vaginal discharge. Not the best word. Not really an enjoyable word. Although I use the word all the time, to be honest. The thing though about discharge is that I'm actually fascinated by discharge, and I really think that there's a lot to learn about discharge. So let's talk about first what vaginal discharge is. Yes, it comes out of the vagina, and it is something that comes out of the vagina. It is a fluid that gets discharged from the vagina. Typically, discharge is made up of bacteria and cells. It's got this amazing function. It literally is there to clean the vagina. It is to rid it of infection, to rid it of bacteria, and it changes over time through a woman's cycle, but also through a vulva owner's basically different stages of life. So if you are maybe pregnant, or you are breastfeeding, or you are on birth control, or you have taken antibiotics or something, it's going to change the amount of discharge that you have. And some people have a lot of discharge, and some people don't have a lot of discharge. The thing about our discharge is that it can change through a hormonal cycle, and I think that's where it also tells people a lot of information about what's going on for their body. So, between your period and ovulation, which is ovulation is when the egg is released. So between your period and ovulation, discharge, you're having a high level of estrogen, you're having a high increase of estrogen. So discharge is going to increase. The levels of discharge is going to increase. And this is the time that it becomes a little bit like white and creamy and like lotion, if we want to say, like a glump of lotion. Also, if it dries in the underwear, it can look a little bit yellow or crusty. I make that note because if the discharge is yellow, green, or off color, that can be the sign of infection. If it dries in the underwear and it can look a little bit like crusty, crispy, and that's when it kind of can appear yellow, that is totally normal and okay. Discharge often also has a little bit of an odor as well, so just to normalize that. So during this time between period ending, so your bleed ends, and ovulation, which is the release of your egg, you're going to have a white, creamy discharge. Then when you come into ovulation, it gets real wet and slippery. There is a function to this. Ovulation is the release of an egg. And so really the wet and slippery is essentially to help function if a spermie is let go or released into the vagina. It helps basically get the sperm up there. It's really making it easier to get to the egg and therefore become impregnated. When you are ovulating and when this type of discharge is happening, it's very clear, it's white, it's sticky. People talk a lot about egg whites. It can stretch, it can hang sometimes when a woman is urinating or a person is urinating. It can feel wet. That's all I keep saying. And people sometimes will want to wear panty liners during this time as well. Women and people with vulvas will notice during the ovulation period through different stages of their life, sometimes they're going to feel really lubricated, wet, and like there's a lot of discharge, and other times not so much. And that's okay. Again, it's just telling you that your hormones are in a different place. After ovulation and between your next period, so before you start bleeding, that's when discharge is going to kind of decrease and it becomes very tacky and dry. So what that's telling you is like egg's been released, and now we're going to be moving into beginning our period. So that's why I say, one, I just want to normalize ovulation. I want to normalize discharge because people don't talk about it a lot. But two, get in there. Get familiar with it. See what's happening. There's so much to learn and to connect to your body in that way. Hope you enjoyed it.